Obsessive-Compulsive Disorder, or OCD, a mental health condition that can turn lives upside down, is often misunderstood and misrepresented. It's not about being overly tidy or liking things in a particular order. Rather, it's a chronic disorder in which a person has uncontrollable, recurring thoughts, obsessions, and behaviors, compulsions, that they feel the urge to repeat over and over. Let's debunk some myths about OCD. Myth: OCD is all about cleanliness and orderliness. Fact: while some people with OCD do have cleaning or organizing compulsions, OCD can manifest in a myriad of ways, including fears about causing harm to oneself or others, or needing to do things a certain number of times to avoid catastrophe. Myth: people with OCD can just stop their behaviors if they really wanted to. Fact: OCD is not a choice or a character flaw. It's a neurobiological disorder, often linked to differences in brain structure and function. People with OCD can't simply stop their compulsions any more than a person with asthma can, just breathy normally during an attack. Myth: OCD is not a serious condition. Fact: far from being a minor inconvenience, OCD can cause significant distress and impairment. Half of adults with OCD experience serious impairment, struggling with intrusive thoughts and time-consuming rituals that can make everyday tasks like working, shopping, or socializing incredibly challenging. Myth: people with OCD don't understand their behaviors are irrational. Fact: many individuals with OCD are acutely aware of the irrationality of their obsessions and compulsions. The inability to control these thoughts and actions, despite this understanding, is part of what makes OCD so painful and frustrating. OCD is not a one-size-fits-all disorder. Each person's experience is unique, and someone can have more than one type of OCD. A common thread, though, is the impact on the individual's quality of life and the importance of seeking help. There's a lot more to OCD than meets the eye. OCD can manifest itself in numerous ways, with symptoms and severity varying greatly from person to person. It's not just about cleanliness or orderliness, and it's not a choice or a character flaw. OCD can be a deeply debilitating condition, often misunderstood due to the many myths surrounding it. Let's delve deeper into the complexity of OCD. There are several types of OCD, all of which involve obsessions and compulsions, but differ in their specific manifestations. Some of the most common types include contamination OCD, where the individual is obsessed with cleanliness and fears germs or illness. Harm OCD, where the person is consumed by thoughts of causing harm to oneself or others. Symmetry and orderliness OCD, where the individual needs things to be arranged in a particular way. And pure O, where the person experiences intrusive thoughts, but not outwardly observable compulsions. The severity of OCD also varies. For some, OCD might be a minor annoyance that causes slight distress, but doesn't significantly impact their daily life. For others, it can be completely debilitating, making it incredibly difficult to function in everyday life. It's important to understand this variability when considering the impact of OCD on an individual's life. OCD is not a choice. It's a neurobiological disorder that people can't simply switch off or overcome through sheer willpower. This is a crucial point to understand, as it can help combat the stigma and misunderstanding that often surrounds OCD. Lastly, it's important to note that OCD is not a sign of weakness or a character flaw. It's a serious mental health condition that requires understanding, compassion, and appropriate treatment. The complexities of OCD is crucial in promoting empathy and removing the stigma associated with this condition. By acknowledging the many faces of OCD, we can better support those affected by it and contribute to a more informed and understanding society. OCD is not just a series of quirks or a preference for cleanliness. It can significantly impact a person's daily life, affecting their work, relationships, and overall quality of life. Firstly, OCD can disrupt daily routines. Simple tasks like getting ready for work or school, or even just leaving the house, can become monumental challenges. A person with contamination OCD, for instance, might spend hours washing their hands or cleaning their surroundings, trying to alleviate the intense fear of germs. This can make it difficult to maintain a regular schedule or to accomplish tasks in a timely manner. Secondly, the emotional toll of OCD can be heavy. The constant cycle of intrusive thoughts and compulsions can lead to feelings of anxiety, distress, and even depression. People with OCD are often acutely aware that their fears are irrational, but they feel powerless to stop the cycle. This can lead to feelings of frustration, guilt, and shame, further exacerbating the emotional distress. Lastly, OCD can strain relationships. Loved ones may struggle to understand why the individual can't just stop their behaviors. They may become frustrated with the person's inability to break free from their routines or rituals. This can lead to social isolation for the person with OCD, as they may start to avoid social situations for fear of their OCD being triggered or misunderstood. The impact of OCD on daily life can be profound, but help is available. In the next segment, we'll discuss treatment options and strategies for managing OCD. It's important to remember that no one has to navigate OCD alone. There are resources and support available, and recovery is possible. Living with OCD can be challenging, but it's important to remember that there are several treatment options available to manage its symptoms. Let's delve into them. Firstly, medication often plays a crucial role in managing OCD symptoms. Selective serotonin reuptake inhibitors, or SSRIs, are often the first line of treatment. These medications help to balance the brain's chemistry, which can reduce the intensity of intrusive thoughts and the urge to perform compulsions. It's important to note that everyone responds to medication differently, and it may take time to find the right medication and dosage that works best for you. Secondly, psychotherapy is another effective treatment option. One specific type of cognitive behavioral therapy known as exposure and response prevention, or ERP, is considered the gold standard for treating OCD. In ERP, individuals are gradually exposed to their fears or triggers, and then learn to resist the urge to perform their compulsive behaviors. Over time, this can help to reduce the power that these fears hold over the individual and can decrease the frequency and intensity of OCD symptoms. Finally, a comprehensive treatment plan often includes a combination of medication and therapy, along with lifestyle changes such as regular exercise, a balanced diet, and good sleep hygiene. It's also beneficial to have a strong support system, whether that's friends, family, or a support group to help navigate the challenges of living with OCD. Remember, early diagnosis and intervention are crucial in managing OCD symptoms and improving quality of life. It's a journey, but with the right support and treatment, individuals with OCD can lead fulfilling lives. Stay tuned for the conclusion of this video, where we'll wrap up our discussion on OCD and its impact on daily life. Treatment options for OCD include medication, psychotherapy, or a combination of both. Early diagnosis and intervention are key to managing OCD symptoms and improving quality of life. Remember, there's no shame in seeking help. Mental health is as important as physical health. In conclusion, OCD is a complex and serious mental health disorder that affects millions of people worldwide. It's crucial to understand the realities of OCD and to debunk the myths that contribute to misunderstanding and stigma. Remember, knowledge is power, and the more we know about OCD, the better we can support those who are affected by it. Thank you for tuning in to this exploration of OCD. If this information has been enlightening, please like, share, and subscribe to this channel for more mental health content. And, as always, be kind to your mind.